Hey, I'm James. I'm a nurse at UK. I work in the medicine ICU. So this week we're supposed to do a video discussion board. So for the first question, I'd say a change I'd love to see in the nursing community would definitely be increased patient ratios. So I know a lot of places are having trouble with understaffing and current issues just leading to people taking more patients than they're used to. I know in my hospital we're having a large issue with understaffing and increased ratios, and it's really dragging morale down. It's decreasing our HCAHPS scores. Our magnet status is contested currently, so it's just causing a lot of issues. I believe that decreasing patient ratios has a lot of positive aspects in healthcare. It increases morale, decreases turnover. It lets your HCAHPS scores be higher because you're giving more time to the patients that need care. It really just overall, when you have more RNs and more techs, you're just going to have a better situation overall. Regarding the second question, I'd say a big changing in the nursing role in the next couple years is definitely going to be increased autonomy, increased responsibility. It seems like it's already kind of moving that way. I know at my hospital, we're getting more and more responsibility. Like in our ICU, we're now responsible for both electrolyte and diuresis of our patients, which is just kind of moving more responsibility on us. We're also going to be more responsible for our patient outcomes. We're in so much charge of the discharge process and education, and just all these aspects are just coming onto the RN, which is a good thing. It gives us more autonomy, and I believe as we see more automation in healthcare, I believe the bedside RN is going to be one of the human roles that will always be there. So to answer the third question, the type of nursing care delivery model I believe that's going to be in place, I would say that patient-centered care is going to be kind of at the forefront of healthcare at that time. So patient-centered care is kind of a unit-based service line idea. So like a trauma patient will go to trauma, and a patient with a heart attack is going to go to cardiac unit, and strokes go to neuro, and pulmonary patient goes to pulmonary. So per our readings on page 39, it's saying that it actually has decreased mortality in a lot of situations with MIs. So that's always a positive. So overall, this model allows the patients to be separated into subspecialties, and it broadens the role of the nurse as a caregiver. So to answer the fourth question, I believe we should focus more on retention of staff. This would do a lot of things positive for us. It would increase morale, patient outcomes. It would decrease our cost of training. So I believe we should focus on retention of staff. And this would also help our ratios and allow the RN to spend more time with patients and decrease healthcare associated illnesses and increase patient outcomes. So for the final question, it's criteria for evaluating effectiveness. I believe a lot of this is already in place. My hospital uses a Press Ganey, which kind of lets us see how staff feels about management, see how staff feels about how staff functions, sees how the unit runs. And also, of course, we have HCAHPS scores, which are patient-driven. So both of those are in place to kind of evaluate how we do our jobs.